Good afternoon, everyone. Thank you for joining our Wednesday live chat here with the executive team. We are glad and very grateful that you are tuning in here live. If you are a resident and or a team member, those of you that are listening tonight on this fine August 19th, taking time away from your family, we appreciate you listening for the next 60 minutes about information regarding COVID-19, evolving preparedness plans, or just simply general community updates. I appreciate everybody tuning in. So for the next 10 minutes or so, yours truly will give a little bit of an update regarding our COVID-19 preparedness plans, in addition to our dashboard. Those of you that just want to hear COVID facts and nothing but the facts, we will relay that information here in the next 10 minutes. From 3:15 to 4 o'clock, the format is as follows. We have Matt Dameron here to give us some other information about memory support, assisted living, and health services. We have David here down in the pharmacy to talk a little bit about our pharmaceutical tidbits and some plans for the next month. We have Sharon Brown here from the housekeeping department. We have Ann Hopper in the clinic, our wellness RN, and yours truly will come back with a little bit more of administrative updates around the community. And then we have Trish Carter with some awesome, great news and some spiritual words of well-being. So COVID-19, just to take a little step back globally, we have probably at this hour, 22.4 million people across the world. The cases, that is an uptick of about 4%. Unfortunately, across the globe, we have 785,000 deaths. This time last week, it was about 748,000, so that's about a 5% increase. Nationally, that trend is also continuing. In the United States, we have about 5.6 million people with a positive case. That's up from 5.3 million this time last week. The unfortunate deaths kind of mirror the global pattern. We have about approaching 175,000 deaths in the United States. This time last week, we're at about 168,000, or a 5% unfortunate increase. Here regionally in Virginia's looking pretty good. Virginia, we've had about at this hour, 110,000 cases, across the Commonwealth. We currently rank 16th nationally with the most cases. In terms of the unfortunate deaths, currently in the Commonwealth, we have 2,410, which is an increase of about 3% from last week. The good news within the Commonwealth that we sit at about 6.7% in terms of our 7-day positivity rate, which is a trending decline. This time last week we were at about 7.6%. So Virginia's hovering with Ohio and South Carolina, and an emerging state that's unfortunately has a sharp increase in cases is Michigan. So between those 4 states, Virginia, Ohio, South Carolina, and Michigan, we all are right in there between nationally ranked 15th, 16th, and or 17th with the most cases across the United States. Here, locally within this market. Henrico County, the county ranking among the Commonwealth has not changed. Henrico is the fifth county across the Commonwealth with the most cases. And as of about an hour ago, we have 4,200 cases, which we've only seen an uptick in deaths around this county of one. This time last week, we were at 186 unfortunate deaths throughout this pandemic. And as we sit here now, that number has only increased to one over the last week. Our positivity rate, our 7-day positivity rate, is at 7.1 right now in Henrico County. Last week, as I reported, it was 8.1, so we're seeing a trending downward turn here in the county, which is good news. Chesterfield also is reporting some good news. The 7-day positivity rate in Chesterfield is 6.3. This time last week, we were at 7.9. So the number of cases collectively in Chesterfield is 4,720, and they have not seen any increase in deaths over this time last week, so that's good news. And then one more statistic within the region, Richmond, the city limits of Richmond, has also seen a steady decline at about a 6.2% positive 7-day positivity rate compared to 6.9 from this time last week. So the state's doing good. Locally, we're doing very well. I just want to really give a shout out to the governor and the cabinet at that level for all of the proactive measures that happened really in June, May and June, to really rally the entire Commonwealth around shared values that we're going to talk about in a second again. That really is the recipe for success. So that's the regional look, and here within Cedarfield, first I want to talk about the licensed areas. Since we always talk about independent living first, we're going to switch gears a little bit and talk about the licensed areas, which consists of memory support, assisted living, and healthcare. So this time last week, we were just about rounding out a second week of testing in the North neighborhood because one of our private duty personnel had a positive case. The good news is that as of last week, we were COVID-free in all of our licensed areas. And in fact, as we sit here today, we are still COVID-free in any of those licensed areas. Not only are we COVID-free, but we have no pending tests in any laboratory. We have 0 resident or team member on any contact tracing list. We don't know of any prolonged exposures here locally or outside the gates of Cedarfield. As of this morning at 7 or 8:30 for our daily call, we had 0 residents or team members with signs or symptoms, and Matt's shaking his head yes, so that's still holding true to this hour. So our dashboard right now, if you're following me with a red light, yellow light, green light terminology, our dashboard is all green right now, which is great news. And the one person, can't forget about that one person that tested positive 2.5 weeks ago is doing okay. She's getting better, so that's the good news. So continued prayers for her. There's many people at the community that know her, that love her, and we're all rooting for her to get 100% cleared from this virus. So the licensed areas, I just want to let you in a little bit into our world. Some folks seem to think that developing a three-phase plan is really all we have to do. And if Lakewood's doing something, or Westminster, Canterbury, or another community is implementing something, why can't we just turn on the switch and replicate whatever any other campus is doing? So, just a little step backwards. Currently, Cedarfield and any other retirement community, assisted living or nursing home, have basically 4 agencies or entities that we need to either take into account or report to. And they are as follows. The CDC makes lots of recommendations, which we need to take very seriously. And those recommendations change every day. Secondly is the Virginia Department of Health. We have a very strong relationship with them. I'm going to give you one example later on in the hour about the billiards room here at Cedarfield. Working with them and their requirements. Third is the Department of Social Services that regulates our memory support area and assisted living. And then fourth, something that just got placed onto our lap just last week, is the Department of Labor came out with their shall requirements in things that we need to do in order to comport with their requirements. So we drafted a white paper on those requirements, and the team is working through that as well now. So we have 4 entities that we have to take into account pretty much every day to make sure that our 3-phased plan that we have implemented in our independent living, but now into our licensed areas, comports with all 4 of those entities' requirements. Let me tell you, it's not an easy task. And so, it's my word of caution to team members, families, or residents that are listening is that while I really appreciate, and I know the executive team appreciates the feedback coming in and the opinion about what we should or should not be doing, especially as it compares to other communities, everyone's evolving. Everyone has an evolving preparedness plan, and our campuses across organizational lines are drafting and implementing these plans for the good of the campus that they work at. And what we don't know behind the scenes is how each of these management teams of these campuses are taking into account those 4 entities I just mentioned and updating their 3-phase plan in order to comport with all of those requirements. So we absolutely appreciate all the feedback coming in. I just want to give folks a pause and a noteworthy step back that there are a lot of moving parts to making sure that the preparedness plan meets all of the requirements that we have to report to. All that being said, the last thing that we have to do, there are 17 items just within the Virginia Department of Health's requirements in order to even head into phase 1 within the licensed areas. And that 17th requirement is complete as of tomorrow. We have to go through an N95 FIT training class. Connie McGowan is scheduled to go tomorrow. And after she attends that class, then we have to fit test all the staff that work and the private duties that work in these licensed 5 areas with an N95 to make sure they are fitted with the right size. And we have to just draw up one letter to send into the Virginia Department of Health attesting that we have complied with all 17 of those requirements just for that one entity. And then we can begin to move into phase 1 for assisted living, memory support, and healthcare. So I know the residents in these 3 licensed areas are really excited to learn about what phase 1 means for them. And Matt, Dameron, Melissa, and neighborhood leaders and clinical leaders over the next couple of days are going to start helping the residents and the families understand what phase 1 means in these licensed areas. So we're right there. We're ready to go. They have the plan. And now it's just a matter of getting this fit testing done and writing a letter and a correspondence back from the Virginia Department of Health that they received it, and then we're good to go into phase 1. So that's the licensed areas. For those of you that are interested in independent living, we still remain in phase 2 of our Cedarfield Forward 3-phase plan. We're continuing to evaluate in phase 2 what makes sense to us, whether or not services and amenities stay where they're at or even evolve some of them. Please just keep in mind that the Virginia governor is or may decide to roll back the Commonwealth phase plan, which may affect our local decisions. But currently, right now, we are in phase 2. I don't have any plans, so Cedarfield doesn't have any plans to roll into a phase 3 quite just yet, for a variety of reasons. Number 1, school. The summertime versus early fall here is obviously 2 different seasons. And so the Virginia Department of Health is very cautious right now of recommending that any community head into another advanced phase because of the unknowns of people that are now going to be more indoors, namely schools and children inside of their houses with homeschooling, etc. And so September is like a pause month for us to see actually what happens with the 7-day positivity rate around the area. Our dashboard right now in independent living is as follows. We have 0 positive cases. We have 0 pending cases. To this hour, we have 0 pending COVID-19 tests. We are not aware of any resident or team member on a contact traced list. We don't know of any resident or team member that has been prolonged exposed. And we don't know of any resident or team member that has signs and symptoms, therefore needing to quarantine. And there are no residents quarantined. Actually, there's 1 resident that is quarantined in independent living. So that's the dashboard for independent living. There are 2 amenities that we are looking at right now to open up. One is the Atrium Cafe, which David will talk about here in a couple of minutes. And the second is the billiards room. I've been working with one resident, Mr. Dick Jones. And if anybody wants to learn how diligently 2 people can work with the Virginia Department of Health and vice versa, the Virginia Department of Health working with us on suggestions to make an amenity safe, go talk to, well, maybe I'm making that offer without asking him. We're going to look at, Mr. Jones and I have been looking at a way to open up the billiards room. And We have been sending emails back and forth to the Virginia Department of Health. They have been so gracious with their time. And I think we're this close to working out a plan to open up that space that comports with great infection control. So just a little shout out to Mr. Jones for all of his time over the last 2 weeks in working with me and the Virginia Department of Health so that we can open up this amenity. So again, David's going to talk a little bit about the Atrium Cafe here in a second. So that is our COVID-19 update. I don't see any questions from Renee, so I'll come back probably around quarter of and talk a little bit more about the power outage tomorrow, among other administrative items. So that concludes our COVID-19 segment. For those of you that want to go about your day, have a great day, and we'll talk to you soon. We're going to continue this live chat with some general community updates. And next, Matt has some information about memory support assisted living in the healthcare area.
Good afternoon, everyone. First, I'd like to just take a couple of seconds and piggyback on what Michael was saying about the Phase 1 plan in the licensed portion of our building. Right before this meeting, I just came from a little get-together with the leaders from Sunshine Plaza and Assisted Living to discuss what Phase 1 might look like when we get there. So we have a pretty good plan. We know, based on what the residents are telling us, what the family members are telling us, that two of the main areas that we really need to focus on and come up with a very creative solution once we move into Phase 1. Those two areas are communal dining and also programming, group programs, individual programming. Those are the two areas, among others, but those are the two that we're really focusing on to try to come up with some really creative ideas. So once we do that fit testing, once we're ready to go with Phase 1, we can jump right into that and make that happen. So very excited to provide that for the residents. Down in Sunshine Plaza, I mentioned a couple of weeks ago that we have started a new program down there where we are taking a trip around the world throughout the year. So each month we'll concentrate on a specific country. This whole month we've been taking a trip through Greece. So they have done individual programming with residents. A lot of food choices that are Greek related, things of that. It's been very well received. So September we are gearing up for Spain, and hopefully by then we'll be able to incorporate some of these Phase 1 processes and make it an even better event. So look forward to Spain this upcoming month. I sent out a memo at the end of last week to the residents, families, and team members of Sunshine Plaza and Assisted Living, announcing that Kathy Moran will be moving from Assisted Living and Sunshine Plaza to being the social worker in independent living. Kathy has been with Cedarfield for 21 years. She spends the majority of that time actually in independent living and has spent the last 7 years over in Assisted Living in Sunshine Plaza. So she will actually be transitioning back to independent living to work very closely with Ann Hopper. And we're also hiring another social worker in the final stages of that to help out in independent living. The memo goes on to talk about how the social services aspects will be covered in those areas. Kathy has been amazing throughout her 21 years here, but has also been great and has spent a tremendous amount of time training our neighborhood leaders, Morgan Four in assisted living and Shannon Gus in Sunshine Plaza, to take over those social services roles. So they are more than prepared and willing to take on that portion of their job, which is actually one of the main roles of a neighborhood leader as we continue down this road of getting closer to this home model. So we're looking forward to Kathy joining us over here in Independent Living and those changes moving forward. In that memo, we also discussed the fact that we will be hiring a program person specifically for assisted living that will help us out tremendously with individual programming, group programming, just the overall culture within assisted living. So on my way here, I actually passed an interview that was taking place. So we are already interviewing for that position and hope to have that filled very, very soon. The last thing I have is just wanted to talk a few seconds about strategic planning in the neighborhoods and households. So we are going to start a strategic planning process where each neighborhood or household gets together the leaders, the rec people within that area, some of our life enhancers and our nurses, even our residents and family members that want to be part of this process to come and help us develop a plan for each of these areas moving forward. Not only through COVID-19, which is very important, but just years down the road, what we want our program as a whole, the culture as a whole in those areas to look like. So we are going to be first meeting for each household in the next week or so, and look forward to bringing some people on board to help us out with that process. So I think that's all I have.
Good evening, all. I have a couple things I have to talk to you about today. Well, we have bumped up our infection control at Cedarfield. We have placed a hand sanitizer in all of the entrances on the independent living side. So for right now, we have all over the A-wing side, you'll see many hand sanitizer stands throughout the building over the independent side. So we are looking and working on some other area throughout the building so we can place those hand sanitizers all over the building so we can stay safe. Okay, and one more thing, we have recycling. Some of you have questions about the recycling. I have put a flyer out yesterday telling you all what can we recycle, what you can't recycle. Excuse me. So for the cottage, on Wednesday, every other Wednesday, we'll be picking up your recycle. And for the apartments in the neighborhood, we'll be picking up your recycle on the 1st and the 3rd on each Friday. So if you have any question about that, please feel free to give me a call. And fall, spring cleaning. We have put that on a hold until next year. I know some of y'all would like to have your mattress turned. Yes, we can turn your mattress. Just give housekeeping department a call. We'll be too happy to turn your mattress. And one more thing, the power hours tomorrow, yes, you will have housekeeping cleaning your apartments tomorrow. They can come in there with the dust, we can make your bed, and do certain things in your apartment. So, if you have any questions, please feel free to call me. Thank you.
everybody. I'm David Stewart, Director of Dining, and I have two brief announcements for you today. One, the first of which is that we are going to be switching our menu for delivered meal service over to the grill menu. And I think that's going to be very exciting for people to be able to get the cooked to order items that people enjoy on the grill menu for delivered meal service. It's going to be a bit of a challenge for the kitchen to develop some strategies to cook meals for 250 to 300 people in such a short time frame. But Chef Tyrone, who's here, and I'm going to introduce him, has been working with his team to make this happen. We don't anticipate any glitches, but if we hit them, please don't hesitate to let us know, and we'll continue to work on it until we get it refined. We will, regarding a menu, we'll be sending out a menu to you in your bag, and we'll also be posting it on our electronic media that will look almost exactly like the grill menu. There'll be one exception, and that will be that at the top it'll say Cedar Grill, and then underneath it'll be takeout menu for the week of. We're going to do that in case there are any differences in the two menus, and there will be rare occasions, but there will be a couple instances where the menus will not be exactly the same. There are some things we just aren't comfortable offering for delivery, for health, safety, or whether it's a matter of we just don't think the item will get to the customer in good condition, thus precipitating a lot of callbacks to the kitchen saying, hey, I'd like this replaced. So we're going to offer almost everything on the grill menu, but in some situations, not exactly. So the menu you're looking at will be in your home. It should say, Cedar Grill takeout delivery menu for the week of, and that way you'll know. When you come to the dining room, you just get the standard Cedar Grill menu. So we're going to try to make that change. We heard from residents that they were a little bored with the menu we've had for a few months now and like some enhancements, and would love to see the food being offered in the dining room. So we're going to make that happen. As I stated, it's going to be quite a challenge. So bear with us as we roll into that. The next fun thing we have planned is we're working on getting the cafe reopened. The first step in that is we're having plexiglass. Plexiglass is kind of one of those terms we use in this world, kind of like Kleenex. What we're actually getting made is Lexan. Lexan looks like plexiglass, but it's much stronger. So we're getting Lexan made, and it's going to be hung as a protector between the guests and the team members. And those are in production right now. We expect those within 2 weeks. So we're looking at, they expect them within 2 weeks. So we're looking at a possible open date of September 1st for the grill. And I'll continue to communicate with the company that's producing these so we can publish a definitive date that the grill will reopen. We're going to reopen the grill for breakfast and lunch only. We're going to be, we would be probably not unable, we would be unable from a staffing standpoint to handle delivery and the dining rooms and the cafe all during the evening meal. So we're going to open for breakfast and lunch and see how that goes. And we're going to limit that initially to residents, and social distancing will be the order of the day. So you'll approach the counter, place your order, and then there will be chairs placed around, socially distanced, where you can wait for your order. So it'll be pretty much the same as it was before the pandemic came along. There just won't be any dining room tables, but we'll have chairs out there, and they'll be distanced apart where you can sit down and wait until your order is announced that it's ready. So look forward to that coming within 2 weeks. And then also on Monday, our grill menu available for delivery. So also, I guess lastly, in closing, I want to introduce somebody who's really made a big difference in the dining department with his professionalism, his calm demeanor, his, I hate these trite terms, can-do attitude, but they're all actually true. It's been a real joy since Chef Robert's passing to have Chef Tyrone Beasley there, looking after the kitchen and looking after the team and responding to resident comments. So I'd like to invite him up so he can say hello and you can see his face.
Good evening. I'd like to introduce myself really. I'm Tyrone Beasley. I'm the new executive chef of Dining Services. Just want to share a couple of things, you know, so you can get to know me. I've been in the food service for over 40 years. I have a degree in restaurant management, so I really enjoy just doing food. So, and I just hope that I can just keep doing what Chef Robert did, and just to make sure that the standards of the dining service stays excellent. So I just wanted to share that with you and let you know that if you have any concerns or questions, feel free to call me. The extension is 8832, or you can email me. Thank you very much.
Thank you, gentlemen. Next up is David down in Remedy Pharmacy. As he makes his way up here, I just want to emphasize again, as I did last week, 2 items that are really 2 services that we have here at Cedarfield that are a blessing. One is the pharmacy, and 2 is Chesapeake Bank. Pharmacies and banks in retirement communities are dwindling around the country. We are blessed to have not only these services here, but dedicated space for these amenities here. Chesapeake does an unbelievable job, and so does Remedy Pharmacy. Contracts like this are only in retirement communities given the participation of the residents using them. So you're gonna, over the fall, we're gonna give a couple more advertisement pushes to these 2 particular entities, and the amount of level of customer service and the depth of amenities within each of these that can be benefiting the residents and team members of Cedarfield. I am hoping that as we go through this marketing campaign around these 2 services, that we see an uptick in support for these 2 amenities and show the bank and the pharmacy how grateful we are that they are here through the participation of the entire campus. So, David has some updates about the pharmacy.
Good afternoon. First, I'd like to say thanks for those who stopped by the pharmacy in the last couple of weeks and said hi, and we've had a few people switch to Remedy for their prescriptions, and I appreciate that. We're about halfway where we need to be with the prescription volume. Hopefully, we can get it up there. Just wanted everyone to know that we're working with James to make sure we have supplies out in the front of the pharmacy and with Ann to make sure that we have what you need. If you need something that's not there, something that you might need that you run out of and don't have, I think it may be something that would be important to keep. I had a resident last week, and I didn't even think about this, but distilled water for CPAP and oxygen generators. And she says she runs to the store whenever she has, when she needs to, and people tend to run at the last minute. So I got with James, and we ended up getting some distilled water. So if you have that situation, if you're using an oxygen generator or something and you need it, we do have distilled water down there now. We still have sunscreen, if anyone needs sunscreen, 30 and 50. And we're heading into the fall season, so we have Flonase and Claritin out front. If you need that, cough and cold medicines, Band-Aids, Vicks Vapor Rub, ibuprofen, Tylenol, PM, Neosporin, Benadryl, all the typical type things that you would need. Pepto-Bismol, Imodium AD, eye drops, lid scrubs, we use a lot of. But if there's anything that we don't have that you think you might need, please don't hesitate to say so. I'll work with James to get it, and if you can't get it, I'll see if I can get it, and we'll make sure we have what you need. Our main purpose there is to make sure that we're servicing or we're helping the residents get what they need when they need it. So please don't hesitate to ask for something, and sure, and same thing, if you need something, just let us know, we'll keep it in stock. And that's about it for today. Again, I appreciate everybody who stopped by and everybody who switched their prescriptions over, and I appreciate it. Thanks. I'll have a good night.
A couple other tidbits from administration. One, if you haven't heard the news, we have a power outage tomorrow from 7 a.m. to 9:30 a.m. I have good news for those of you that have not had a chance to read the latest memo around this power outage scheduled for tomorrow, which should be in your mailbox in the cottages and or cubby boxes here in the apartment building as we speak. The good news is that as late as yesterday at 5:30, I received word that we will not be on power generator from 9:30 to 4 o'clock. We will be on full power throughout the rest of the day. So that's a little ray of sunshine coming into the campus today. We will be, the memo that's in your cubby box or your mailbox talks a little bit more about the power outage tomorrow, so please retrieve that memo. 2 highlights for me in the memo. One, probably the most frequently asked question, will I be able to order my dinner through the call centers via my phone in my cottage or apartment? And the answer is yes, because we'll have full power. So you can absolutely order your dinner through the normal call center and the calling times. The second word of caution is, since this why are we doing this? I forgot to include that in the memo. Why are we shutting off the power, Michael? That doesn't make sense. So the new household building that we have under construction, they are about 65% complete in that project plan. And right at the 65% completion milestone calls to connect the power to the building so they can finish the rest of the project. So we have to shut down this main building and the generator, because that building is also tied into the generator, for these 2.5 hours to tie in the main feed for that new construction. We chose the 7 o'clock hour because tomorrow it's going to be 68 degrees up until about 8 o'clock, 9 o'clock. So it's a very cool morning. It's supposed to be in the 60s all night long, starting at 11 o'clock tonight. And so that's important because it's a total power shutdown. So we do not have air conditioning. So I would encourage you, if you really like your apartment cool, crank things up so that you have that extra cool air in your apartment. I hope I said that right for Jack. Because there won't be air conditioning from 7 o'clock tomorrow to 9:30 a.m. tomorrow. The other word of caution is, if you live, this doesn't affect the cottages, This is just the main building. If you live in an apartment, my caution to everyone is the elevators will not work for these 2.5 hours. If you have an appointment, if you need to leave the community, we all might be tempted to walk down the stairwells towards the end of A wing, B wing, C wing, and D wing. But those stairwells are not lit, nor do they have natural light coming in them. So if you could please use the Atrium Cafe to get down to the stairwell around that rotunda to get down to the first floor, that would be very advisable. Or, there is no or. Or you can use the steps down towards the Parkview area to get down to that first floor. So those are my words of caution. There's a frequently asked questions list in your cubby box and mailbox, which talks about other things. Do I need to highlight anything else? Fobs? What about fobs? Fobs are not working. Fobs will not work either. The good news, one more thing about good news, the front desk, the concierge desk, that phone will work, the 8800 number. So if you need anything throughout those 2.5 hours, you can either do one of three things. Pull your pull cord, and we will get to you. Second is you could call the concierge desk, and we'll triage things accordingly. And then third, because we're going to be on a fire watch, you're going to see a couple of people roaming around in between A, B, C, and D wings. And so you can ask those individuals for assistance and they can help you. They'll have walkie-talkies with them, flashlights to help out. And then the last thing I would just share is that coffee is a big thing for some people early in the morning. So we will have coffee available. And I think somebody is going to pick up a good, healthy number of donuts to be able to share with people. So there'll be a coffee station and a donut station on each floor so people don't have to go down steps if you would like some coffee in that atrium rotunda area on each floor. So that's the power outage. The wellness building, just an update. Last week we talked about a silencer in the pool area. I was just told by Matt that project was complete about an hour and a half ago. So those of you that swim in the pool or enjoy the exercise programs, you should see and actually hear a significant reduction through the HVAC system. Pub 2300, or as I affectionately label our Rainforest Cafe, that renovation should be complete by next Friday. It's all dried out. We don't have any environmental issues. So it's a matter of just painting and patching and sanding that area, not in that order. So that will come back online next Friday. D-Wing, we now have 4 residents living on the 4th floor. The 2nd and 3rd floor are due to be delivered back to Cedar Field probably still by the middle of October. For those of you that are interested in the sidewalk repair between B and C wing, that will happen. It will commence on Monday, the 24th. Also, that will commence on the 24th will be the vacuuming of all that dirt inside the pond in the wellness courtyard to get that waterfall back up and functioning. The Cedarfield Parkway pond, that project is complete. If you drive out Cedarfield Parkway, you'll see that the channel down to the pond now has hay on top of it, which hopefully that grass will grow relatively quickly. And then the final thing for me, I think, is A very dedicated team member named Amanda Kelly is leaving us on Friday. And I made this announcement last week. We're having a little farewell party for her tomorrow, and I'm just giving a plea one more time to come and wish her well in her new adventure over at the Hermitage of Richmond. She has faithfully dedicated 13 years of her life to building Cedarfield to what it is today within the Wellness and Leisure Department, the concierge desk, and transportation. So I know she would appreciate residents and team members alike coming by to wish her farewell. Not a goodbye. It's just simply a farewell. She's just right down the street. So next up is Ann Hopper with some COVID-19 facts, and then followed up by Trish Carter.
Hi there. Okay, still with COVID, we're asking for you to call the clinic if you need to come in and have a blood pressure done, see me, see Tessa, just so that we can maintain the social distancing and not having too many folks in the clinic at one time. Bonnie's requesting the updated, if you need your Vial of Life updated, you can either call in with it or you can make your changes and send them in to us. The important information we need on these Vials of Life, besides, an emergency contact, would be updated medication list and then updated insurance information. We still have some Medicare numbers that have an old your Social Security number, which that changed over, I guess, a year and a half ago, where they have letters and numbers for safety. So we do need copies of that because they're being kicked back. If you have labs, the bills are now being kicked back from Medicare if we don't have a current Medicare card. Another one is flu vaccines. Flu vaccines are extra important this year, and we're going to be doing them here in the Fellowship Hall, and we're going to be doing them October 22nd and 23rd. Those, a memo with the form for you to complete so Medicare can be billed will be sent out the end of this month, and it'll be coming from the clinic. So look forward to that memo to come. And then I just wanted to go over emergencies. With COVID here, we will have our nursing supervisor. There's always a nurse on premises to come to you for an emergency. They will have their PPE on. They'll have everything from the mask to a shield, the gown, the gloves, everything. It's protecting them and it's protecting you. So if you have an emergency, you pull that cord. If you want to talk to a nurse, you can call the 8870 or my number, 8847, and it would be forwarded to healthcare, and there's always a nursing supervisor to talk to if I'm not available. And that's about it.
Good afternoon and good evening to the Cedarfield community. My name is Trish Carter, and it is my honor to serve Cedarfield as a chaplain. I would like to share with you some excerpts from a book called The Gift of Years. It is written by Joan Chittister, and the chapter that I am excerpting is Regret. Do not brood over your past mistakes and failures, the Indian Swami Sivananda wrote, as it will only fill your mind with grief, regret, and depression. Regret nibbles around the edges of the mind, and we feel the weariness that comes with it. This compulsion to look back, to explain myself to others, why I did what I did, or worse, to justify why I didn't do something else, is one of the most direct roads to depression we have. Regret claims to be insight, but how can it be spiritual insight to deny the good of what has been for the sake of what was not? No, regret is not insight. It is, in fact, the sand trap of the soul. By all means, we must look back. By all means, we must ask ourselves why we are where we are. And we must also ask why we did not do the things we thought, at least at one time, we wanted to. Those answers and those motives tell us who we really are. The burden of regret is that unless we come to understand the value of the choices we made, we may fail to see the gifts they have brought us. The blessing of regret is clear. It brings us, if we are willing to face it head on, to the point of being present to this new time of life in an entirely new way. It urges us to keep becoming. This is a wonderful transition to our good news today. It has been difficult for our youngsters to make college decisions during this time of COVID. My good news is that my daughter, Grace Carter, begins her new adventure today. You see, Grace has always been fascinated with airplanes. And today, Grace Carter, who is now an 18-year-old, starts her first day at Averett University in Danville, Virginia, where she is an aeronautics major. So this past couple of weeks, Grace has been in airplanes exploring her new world, and I could not be more proud of my baby pilot. You all have a wonderful evening.